Hi, I'm Kevin Canals of InsureMeKevin.com, a licensed insurance agent in California. Today I wanted to present a high-level overview of Medicare and the different parts that you can put together to create your Medicare coverage. But I wanted to do it in a little bit different way. I wanted to make this as an analogy of you building a train, like on a railroad. Because some of this Medicare nomenclature stuff with all the different parts and the plans and whatnot can just be kind of overwhelming. But it is very analogous to you building a train where you are in charge of the Medicare engine. So, you ready to get started? Alrighty. First, you need to enroll in Medicare. And when you do that, you'll get Original Medicare Parts A and Part B. And when you enroll, you'll get a claim number, which is your Medicare claim number and that ID card, that red, white, and blue card. And that allows you to couple on different parts of your railroad, your train, onto your engine. So one of the things, once you have that Original Medicare Parts A and B, Part A is your hospital, which covers inpatient hospital and skilled nursing facility. Part B is your outpatient, which is doctor visits, labs, tests, x-rays, and they all have different kind of benefits within Original Medicare. But once you have that, you have two different options. You can go with Original Medicare and a supplement and a Part D prescription drug plan, or you can go with a Medicare Advantage plan. But not to make things too complicated in some of this stuff right now, but one of the big things is you must have a Part D prescription drug plan. If you don't enroll in one of those, then you'll get hit with a penalty later on, and we don't like that. So just remember, that's one of the things you need to have. So your engine is Original Medicare Parts A and B. You own it. It will never be taken away from you. You're the driver, and you determine what you're going to hitch on to your engine to go down the tracks. So, like I mentioned, the first thing that you always need to consider is you need to have that Part D prescription drug plan. Now, there's a lot of different ones. They're always different in other states. You can go to medicare.gov and put in your zip code and see what plans are available. You can do a drug search to then see what plan is going to give you the best benefits for the prescription drugs you are taking with the premium that is being offered for the plan. So that is a very important part of your Medicare train. And once you have that, a lot of people just have Original Medicare, your engine, and that prescription drug plan, and you're okay. But some people would also like a few other benefits. Now, we have to remember that Original Medicare does not cover any dental, vision, chiropractic, or podiatry. So if you want dental and vision insurance, you'll need to get your own plan. So you can go out and get an individual vision or dental plan, and it will always be yours, and you can hook that onto your train. So now you can have Original Medicare, your engine, a Part D drug plan, and a dental and vision plan if you so choose, and you can uncouple those. The prescription drug plan, you can change that every year at the annual enrollment period, which happens between October and December for the next year. So if you don't like the one you're in or it's changed, you can unhitch that flatbed car, that prescription drug car, and go get another one. So now the other option is, one of the things we need to think about is that Part A and Part B do have deductibles and coinsurance with them. Now for Part A, if you're hospitalized, for 2020, it's going to be a $1,408 deductible. Okay, so you can be in the hospital up to 60 days and you're just going to be paying that one deductible. If you are hospitalized again, like on the 65th day, you incur that deductible again. And of course, there are also those daily co-insurance if you're in the hospital for a really, really long time. We don't want that. So there is no maximum out-of-pocket cap on any of the original Medicare parts, like Parts A or Part B. So these charges can reoccur over and over during the year. Now on Part B, your outpatient, seeing the doctor, labs, tests, there is a $198 deductible for 2020. And once you have moved through that, then you go into 20% coinsurance, which doesn't sound too bad. If the doctor's office visit is $100, 20% is $20. That's not too bad. But if the doctor orders tests and labs and imaging and you have to go through outpatient procedures, then 20% of a procedure that costs thousands of dollars really starts to add up. And again, original Medicare does not have any maximum out-of-pocket caps on it like a traditional health insurance that we're all kind of used to. So that has always been the real sticking point to the Medicare train. So they developed Medigap plans, or Medicare supplement plans. Gap, Medigap, filling the gap, supplement, the supplement to original Medicare to cover the costs that Medicare doesn't, your cost sharing. Now, original Medicare is Parts A and B. These Medicare supplement plans are plans, and they are designated with letters A, G, L, K. So don't get them, those are really easy to get confused. However, Plan A, regardless of the carrier, is going to be the same. So if carrier ABC is offering Plan A, it's going to have the exact same coverage benefits as carrier XYZ. And all the different plans include more and more coverage. So I think the Plan G has the greatest coverage benefits, pretty much covers everything except for that Part B deductible. And of course, the higher the coverage, the more the monthly premium. So that's kind of something to think about, and you can research those, but those will help cover your gaps. So you can hook a couple, a Medicare supplement train car onto your engine, and then you have a two-car engine or a two-car train, and then you can put on your prescription drug plan, because the Medicare supplement plans do not include any prescription drug benefits. Those always going to be separate. So you're going to have your engine, a Medicare supplement, and a prescription drug plan if you want to go that route. And then you're kind of covered for some of the unexpected costs that Medicare doesn't pick up with your supplement plan, and then you have your prescription drug plan to cover those costs. And of course, you can also add dental and vision. Now, again, the Part D plans, the prescription drug plans, you can change those out every year. You can also switch those Medicare supplement plans, usually in the month of your birthday. You can switch to a different carrier. And there are some limitations. When you turn 65, you have a 6-month window of guarantee issue. So regardless of your health conditions, you can get that Medicare supplement plan without any underwriting, no pre-existing condition clauses there. So then you have your train that you've assembled with a supplement, a drug plan, and any dental and vision. Now, the next alternative are Medicare Advantage plans. And these were developed back in the 2000s. And a Medicare Advantage plan is more like a traditional health insurance plan that we're all kind of used to. There's regular co-pays. There might be co-pay for if you're in the hospital, might be a couple $100s a day up to a number of days. And there's some co-insurance. The Medicare Advantage plans cover everything that original Medicare does. All of the claims go through that Medicare Advantage plan. See, original Medicare is like a giant PPO. You can be in a completely different state. You can be in Florida and live in California, and if you need to see services, you can contact a doctor, and if that doctor accepts Medicare assignment, you can see it. The doctor will bill Medicare. But when you're in a Medicare Advantage plan, that company handles all your claims. And the Medicare Advantage plans can have networks that kind of limit where you can go. Many are HMO plans, so you'll need to have a primary care physician selected, and then that PCP will refer you to specialists. The Medicare Advantage plans are known as Part C of the Medicare portfolio, and they most oftentimes include prescription drug coverage. So you don't have to worry about adding a prescription drug card onto it. There are some plans that don't have that, and you want to very carefully research those in your different alternatives. But a Medicare Advantage plan for many people works just great because it's kind of an all-encompassing thing. But you can only get a Medicare Advantage plan if you have your engine of original Medicare Parts A and B and that claim number. And you put those two together and you've got your coverage. Now, if you want dental and vision, that can be extra and you can couple that car onto your train. Now, many of the Medicare Advantage plans will have some other benefits. They may have some vision benefits or hearing benefits that are over and above what Medicare will cover. And the only problem with Medicare Advantage plans is they can change every year. They might drop that ancillary benefit. The plan may just completely go away because these plans are done by county. So you just have to kind of be careful. But if you have your own dental and vision plan, it's always yours. It's always on that car. And regardless of the Medicare Advantage car you have, you'll always have that flatbed car of dental and vision. So you put those together and you have a Medicare Advantage train driven by your engine. The Medicare Advantage plans, just like those prescription drug plans, you can change those every year at the annual enrollment period. So you can uncouple that Medicare Advantage plan and go with a different one for the next year. Remember, you're the engineer of your Medicare train. So to kind of recap, we got kind of 3 different ways that you can kind of do this. You can go with original Medicare with just a drug plan and a dental and vision, knowing that you may have some costs that are not covered, that you're going to be on the hook for the Part A deductible and co-pays and Part B deductible and co-insurance. The next level is hooking a Medicare Advantage plan onto your engine, and then that would give you the drug coverage and any other ancillary benefits. And then you can put your dental and vision car on there. And then the third option is you hook a Medicare supplement onto your Medicare engine with a prescription drug plan, and if you so choose, a dental and vision plan. So that's how you build your train. And the great thing about Medicare is you can always change those cars if you don't like them. If you don't like that party car, you can unhook from it and hook up a different car onto your train as you are going across the United States. So hopefully that kind of helps you give a little bit different way of looking at Medicare, and it might help you kind of understand how this whole thing works, because as you are entering Medicare, it's very important for you to get your arms wrapped around Medicare and how it works so you can make the best decision going forward. It's nice that you always have decisions with Medicare during the annual enrollment period, and you can change things. It's very flexible, but initially you need to kind of understand as much as you can about how Medicare works. And I think the train analogy is kind of cool. So there we go.